Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi, Dr. Darrow.
Nita Valens, how are you today?
I'm great. How are you?
I'm living it up. We're going to talk about stem cells and platelet therapy, PRP, today, and how to get people healed from their orthopedic issues, injuries, and arthritis instead of having surgery. It's a great topic. I've been doing this work over 25 years. Since my residency training at UCLA. And for those of you that want to call in, you can talk to me live right now, right at the studio. I'm going to give you out the phone number. Grab a pencil. It's 866-870-5752. That's 866-870-5752. If you call me right now, I'm going to send you a free copy of a $25 book called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And the whole idea is to regenerate your body, to rejuvenate it, and to make you young again in the joints, ligaments, tendons, anywhere really from the back of the head down to the bottom of the feet. So I inject the muscles, the ligaments, the tendons, and all the syndromes that you think are causing your pain may not be. So be very careful not to get a surgery when you don't need it. Again, I'm going to send you out a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The foreword is by Suzanne Summers. Thank you, Suzanne. And there's a couple hundred pages in here and about 250 studies, scientific studies, that explains how regenerative medicine using platelets and stem cells and prolotherapy work, and why surgeries are not a great option anymore now that we have this. So, Nita, I didn't give you a chance to talk, and I know you like to, so what do you got to say?
Well, I got to say that when you call the program today, you get Dr. Darrow's book for free, which you just said, but the interesting thing is stem cell and platelet therapy, Regenerate, Don't Operate, has 264 scientific studies. That's a fact. And also, if you go onto the website, www.jointrehab.com, that's jointrehab.com, you can watch Dr. Darrow performing the treatments on videos that we're talking about today, and you can also email him off of every page on the site.
It is amazing, and I do email every person back, typically the same day. So I would love to hear from you. And again, the phone number to talk to me right now live, you can ask all your medical questions related to orthopedics, 866-870-5752. And if you do want to call the office, there are people by the phones there. The number there is 800-300-9300.
Sounds great. So that number again is 866-870-5752 right here in the studio, so you can call and speak directly to Dr. Darrow. And we'd love to get your calls.
Until we get a call, Nita,
yes.
Why was Cinderella so bad at soccer?
Because her glass slippers wouldn't slide on the ice.
Well, that's good, but it's really because she kept running away from the ball.
She kept running away from the wall.
The ball.
The ball. Okay. The ball. Okay, that makes sense. I thought you said wall. Must be my hearing.
It might be. I'll give you a second shot here.
Okay.
What do elves learn in school?
How to dance around Santa.
The alphabet.
The elf. Oh, that's a really good one. That's cute.
All right, since you're not laughing, I'm going to hit you with another one. You ready?
Yes.
Where was King David's temple located?
King David's temple was located in London.
Above his ear.
Oh, That's a good one.
All right. Now, I know you're going to get this one, Nita.
Oh,
You
yeah,
ready?
right.
What did one toilet say to another?
Toilets don't talk.
You look flushed.
That's a good. I love that one. That's
Finally,
good.
finally, I've got a laugh on
Okay,
poor
so
Nita.
let me ask you something.
Yeah,
Will you buy our breakfast today?
of course.
Okay, great. Thanks.
Everybody's hungry. Why not? Even though it might be dinner time.
So, so if somebody's brand new to the program, what do you want them to know?
Well, the new paradigm of orthopedic medicine is not surgery. And I know orthopedic surgeons disagree with me on that, but I'm saying the new paradigm. The new paradigm is to regenerate the body and rejuvenate it and heal it, not cut out tissue. And I'm going to go to some questions right now that hopefully will give us, hopefully give us some ideas on how this stuff works and see what people are complaining about and what their issues are. All right, let's see. Question number 1. It says allograft knee surgery. So allo means from somebody else or some other thing. Auto means from yourself. And an allograft in the knee is typically the ACL, the anterior cruciate ligament. That's the most common surgery that's done with an allograft. So let me see what the person says. Looking for consultation for my labral... No, that's the wrong one. We'll get to that one next. Good morning. I am here after a knee surgery allograft 6 months ago. I would like to continue treatment and do stem cell injection. Okay, probably a smart idea. Do you do stem cell injections? Yes, I do. And if so, please let me know more details and possible dates for an appointment. I would be grateful for your answer. Best regards. All right, so what are stem cells? How do they work? Why would we put them in a knee after a surgery? Okay, so the answers are pretty simple. Stem cells are cells that actually keep us alive. They regenerate and grow new colonies of tissue. So if this person had a knee surgery allograft and they're still complaining about the knee 6 months later, they got a problem. And we see it all the time. I see it every day. I get new patients in who have failed surgeries. It could be failed back surgery, failed knee surgery, shoulders, necks, muscle tears. It doesn't really matter what it is. Ligament pain, back pain, you name it. When people have surgeries for these things, most of the time it shouldn't be done, in my humble opinion, because surgery is very invasive and regenerative medicine using platelets and stem cells is very conservative. It's very simple to do. Why would we put them in the knee after a failed surgery? To regenerate and thicken up the tissue. Now, this person had an ACL surgery. It doesn't say that, but when they say allograft in the knee, that's typically what it is. I don't do that. When people have ACL ruptures or tears, the first thing I do is I use my ultrasound, which looks inside the knee, and I can put a needle exactly where the fluid is. And if it is actually an ACL rupture, the fluid that comes out is frank blood, dark red blood. We get that out immediately before it clots up, and we let the knee heal. And then we'll start maybe a week later doing stem cells or platelet therapy in that knee to help regrow whatever part of the ACL may be ruptured. And sometimes people come in and they'll have an MRI with them that an orthopedic surgeon did, and they were told they need to get this allograft implanted immediately. And that can be taken from the person. Typically it's the middle part of the patellar tendon or the hamstring tendon, or it can be taken from a cadaver, from a person that died, and we're grafting from that donor, which is an allograft from a cadaver. And we place that in where the ACL was. We take out the old ACL and plug it in. But a lot of those rip afterwards, again. And one of the issues is the MRI may show an ACL tear when it isn't really torn. And sometimes a surgeon will go in to repair it and be befuddled because they'll see the ACL in place and not torn. And the blood that comes out might be from a meniscal tear. So typically, if a patient's knee swells up immediately, that is an ACL rupture. If it swells slowly over a day or so, that might be more of a meniscal tear, just to give you an idea about that. But the first thing I do is I numb up the knee, I aspirate out all the blood. Sometimes I'll get 100 cc's of blood. Sometimes I'll get maybe 10 or 20 cc's of blood. And that allows the knee to start healing again. Most people that I see that supposedly have an ACL rupture do not have problem with their knees after I'm done treating them, and they never had to have surgery. The knee is stable. Most knees are stable after an ACL rupture. Once in a while, I'll get someone whose knee is not stable, but when I say once in a while, I'm talking about like once every 10 years. And I've been doing this work for 25 years, so that's only a couple people I've seen where the knee is actually loose. Okay, most people have enough structure around the knee, even if they did have an ACL rupture, where they do not have to have surgery. And there's many pro athletes that perform very well with ACL ruptures. So don't think because you have an ACL rupture, tear, that you need to have an immediate surgery. And the studies show that if you do have an ACL rupture, you get better results by waiting for at least 3 months. Okay, so comparing people that have an immediate surgery to one that waits 3 months, you're better off waiting and letting the knee heal on its own before you consider having a surgery. And in most cases, like I say, I don't ever need to send a patient to a surgeon. We heal it up on our own just doing stem cell and platelets. Nita, you're fussing. What's going on? You want me to give out the phone number? Okay,
yes,
here it is.
Please.
How do I know how to read your mind after all these years?
Well,
how many years you been hanging with me? 15 years or so?
We're in our 14th year.
14. Okay.
Yeah.
Not bad. Maybe by the 15th year I'll grow back the hair on my head. Who knows?
Oh, I absolutely believe that's possible.
All things are possible.
Absolutely.
And by the way, there is a doctor that I knew for years who lost his hair. And I saw him a couple years later. Hadn't seen him for a couple years. And he had a full head of hair. And I said, what happened to you? Did you get an implant? Did you get hair transplant? He goes, no. I started using growth hormone. And it grew all my hair back. So a lot of good things can happen in medicine that we don't really think of as traditional medicine, but things that do help people heal. And growing hair on the head is sort of a healing, right?
Absolutely.
All right, so the phone number, talk to me, call me, 866-870-5752, 866-870-5752. We're waiting for your calls. And if you do want to call the office and get more information, the number to the office, 800-300-9300. That's easy, 800-300-9300. And if you want to watch me doing videos of these procedures, you can go to my website, www.jointrehab.com. That's jointrehab.com. There's a spot on every page to email me. And if you do call right now, 866-870-5752, I will mail you out postage-free a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And you'll get to read the foreword by the lovely Suzanne Summers, who also wrote a chapter about me in her new book. What's the name of the book, Nita? I know you have it.
A New Way to Age.
Yeah. And there's an entire chapter about regenerative medicine, how it helped her. And we've worked on her son Bruce and her grandkids. So I'm sort of a legacy in their family. I've been working on them for a long, long time. Her son Bruce used to live next door to me, and he would get injured in biking accidents. He used to be a road biker. And he'd run over to my house, or limp over to my house, I should say. And I would inject him laying on the floor on a sofa. And we've gotten him better every time. Nita, we got your neck better, didn't we? How many years ago was that?
Yes, that was,
in the early days.
Yeah, that was, 17 years ago, 18
Something
years
like
ago.
that, yeah.
Because that was the prolotherapy days.
Yeah, and you're better. Have you ever had any neck pain since we worked on you?
No.
All right, cool. I'm going to go to another question, if you don't mind, Nita. I know
Let's do it.
You have ideas of things you want. This one's called shoulder pain. Let's see what this guy or woman has to say. This is good. Looking for first available appointment for shoulder pain issues. I've broken my right collarbone twice, once 30 years ago and once about 15 years ago. Now having extreme pain, unable to stand with corrected posture. Interested in all options, including steroid shots, PRP, stem cells, etc. All right, so typically the collarbone fractures when people fly over their handlebars of their bicycle. That's the most typical injury that I see. And often they get a separated shoulder from that too, where the clavicle, the bone that runs from the sternum to the acromion, that's the AC joint, acromioclavicular joint, gets separated. So they call it a separated shoulder. But often the collarbone can be fractured. And I've worked with tons and tons of those. And hopefully this person has healed that. But they're still having extreme pain, probably at the AC joint. And if you want to see what these things are, go to Google, put in AC joint or shoulder separation, and it'll bring up some information. In the upper left-hand corner, there's a spot that you can click on that says images, and you can see pictures of what your imagery or your arthritis is all about. And you'll have an idea what I'm talking about. So I have worked with tons of these over the 25 years I've been doing regenerative medicine, back since around 1997, 98 when I started doing this work. And they say I'm the busiest guy in the world doing this. I do it all day long, every day, and I love it. Very often I'll get patients in who have had surgery on that AC joint, which is insane to me. The surgeon will cut off part of that clavicle, the distal part where it articulates with the acromion, and then the pain gets worse. That's harder to heal after a surgery, but we can still do it. It's a little teeny joint, and many people have come in saying their surgeon wants to operate on it, and we can use something as small as a 30-gauge needle. That's teeny-weeny, like an acupuncture needle. And we can push the solution to that and heal that joint. And I've had that problem myself. I have injected my own shoulder, healed it up, and actually I've done stem cells on both my knees, both my shoulders. I've done platelets on my elbows and what else? My wrist. What else have I had done self-inject? I know people go, you inject yourself? Yep, it's easy. There's nothing to it. For my neck and back and my ribs, I had fractured ribs. I've had other people do it for me. I have my staff help me out. And I typically will use an ultrasound so I can watch where the needle is going. And it's very sad when people come in with failed injections by a doctor because they didn't use an ultrasound, and they don't even know where the joint or the issue is, the tear is, that they are trying to heal. So be careful if you get this work done. I don't care if it's a steroid shot or PRP stem cells, whatever it is. Hopefully you don't get steroid shots, because that is not the best thing for your tissue, and it actually destroys, it softens up the cartilage if it's in a joint. So I do very minimal amount of that. I did have someone come in with a completely frozen shoulder, what we call adhesive capsulitis, the other day, and she didn't have a lot of money. So we did a steroid shot in her shoulder, and the biggest place to do it, the most important place to do it, is actually the subdeltoid bursa. So I hit that, and her shoulder got a little bit better. She got about 20 degrees more range of motion within about 5 minutes. And typically over the course of about 3 or 4 days, that shoulder joint is going to open up. And the cool thing about using the ultrasound is I can put that needle exactly into the joint or on tear. She had some problems with her subscapularis tendon also. So I put a couple of drops there. And before my eyes, I saw that shoulder start moving better. And I haven't talked to her since. I gave her my cell number, and I give all of my patients my cell phone number. And if they have an issue, they can call me up, or they just want to share their joy of healing, they can call me up. So I expect this person will come back. I think she set an appointment for next week. And at that point, if it's not completely feeling better, I will inject some platelets and or stem cells into the issues in her shoulder and get it healed up. So we're still looking for callers. The phone number here, you can talk to me live. Write it down, 866-870-5752. And if you want to call me at the office or find out more information about these treatments, just call the office, 800-300-9300. That's 800-300-9300. And if you want to watch videos of me doing these procedures, see if it's something you would like to do, go to www.jointrehab.com. That's www.jointrehab.com. And I've got other questions. I've got something else to say before we go to the break. Although most of what I do is on the musculoskeletal system for orthopedic pain of arthritis, rotator cuff tears, meniscal tears, labral tears, muscle tears, ligament sprains, all those things, by regenerating and thickening up the tissue. These procedures can also be done on the face. It's called the vampire facelift. You won't forget that name. And it actually thickens up the collagen in the face and plumps it up and makes people look young, which is a real good idea. People walk out and actually look younger, and by the next day they look amazing. It can also be done, and there's chapters on this in my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The last couple chapters are on the vampire facelift and on how to regenerate hair that is thinning on the top of the head. So we can revitalize the hair follicles by putting PRP and or stem cells into the scalp. So there's a lot of uses for this type of work. Nita, you're breathing again. That means you want me to tell a joke?
No, I just forgot.
No!
No jokes. No, I just forgot that I'm not supposed to breathe. That's all.
No, you don't need to breathe. You can go into what's called samadhi. You know what samadhi is?
Yes, I've been in samadhi. It's a very, very deep meditative state. I love samadhi.
What are some other names for samadhi?
Well, I've heard it pronounced samdi.
Okay.
I'll have to look that up for you.
So I just did my spiritual exercise this morning, and I had that experience too. It's an amazing experience. It's very healing on all levels, not just physical, but emotionally, mentally, and it calms everything down. Do you do that every day, Nita?
I meditate every day, and then again at night sometimes, but not every night.
I do about an hour every day at the office when everyone's having lunch. I have a bench there that I lie down on with a little pillow, and it rejuvenates me for the rest of the day. So, Nita, what lights up a soccer stadium?
Lights.
No, a soccer match.
Ha. Sneaky.
Okay, you got another shot here. You ready? What does corn say when it gets a compliment? Aw, shucks.
Oh. I never would have got that.
Well,
never, ever.
Today's not your best day, but you have had some good days.
I have had some good days.
So I'm going to give you an easy one because I've said it once before months ago. You ready?
Ready.
And I know you have a good memory. What's red and bad for your teeth?
A newspaper.
A brick.
Oh.
Nita, come on. I know you're a genius.
I don't know.
Well, we're
about
coming
that.
up to the break, but let me try to sneak in another question. How's that?
An email. Excellent idea.
Here we go. Okay. This one is on the back. Let's see what it says. Pain after L4-5 discectomy. We're going to the break. Give us a call live here after the break at 866-870-5752, or you can call the office anytime at 800-300-9300, or go to the website, www.jointrehab.com. You can watch me do these treatments. Thank you, everybody.
We'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.